Good evening. I'm Ariel Reshef here with the latest on President Trump and his battle with COVID-19. And some breaking news. After teasing it on Twitter, President Trump briefly left Walter Reed Hospital in a motorcade to greet supporters waiting outside. The president was wearing a mask, and you can see him waving at those supporters through the window. We should note the president remains hospitalized and will not return to the White House tonight. As President Trump remains hospitalized, a White House official tells ABC News that Vice President Mike Pence and Second Lady Karen Pence both have tested negative for COVID-19 again today. That's the third day they've tested negative since President Trump's diagnosis. This comes after the president's doctors at Walter Reed told reporters that President Trump is getting better, but did receive supplemental oxygen on Friday. ABC's Rachel Scott has the latest.
Tonight, in a surprise move, the president taking his motorcade outside Walter Reed Medical Center. You could see him in a mask, waving to supporters who have been lined up for hours wishing him well. In a new video saying he's learned a lot about the virus during his experience at the hospital.
And I get it, and I understand it, and it's a very interesting thing, and I'm going to be letting you know about it.
Earlier, the doctor responsible for the president's health walking up to the microphones to give an update on his patient and update his own statements. Dr. Sean Conley explaining why he intentionally withheld information from the American people, saying he didn't want to raise alarm.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. I didn't want to give any information that might steer the course of illness in another direction, and in doing so, it came off that we were trying to hide something, which wasn't necessarily true, so here I have it.
The White House releasing these images. The president out of bed and behind a desk at Walter Reed Medical Center, saying he continues to improve. But the mixed messages from physicians and the administration raise questions about the true nature of his condition. Today, Conley telling reporters he did administer oxygen to the president at the White House on Friday for about an hour after his blood oxygen dropped and he had a high fever. Sources tell us Trump had trouble breathing.
I was concerned for possible rapid progression of the illness. I recommended the president we try some supplemental oxygen, see how he'd respond.
That admission coming after he made false statements while evading repeated questions just 24 hours earlier.
Yesterday and today, he was not on oxygen. Thursday, no oxygen, none at this moment. Yeah, and yesterday with the team, while we were all here, he was not on oxygen.
Conley has already backtracked on the timing of the president's diagnosis and adding to the confusion, minutes after he delivered a rosy assessment of Trump's condition.
We remain cautiously optimistic, but he's doing great.
White House Chief of Staff Mark Meadows warned Trump's vitals over the last 24 hours were very concerning, cautioning the next 48 hours will be critical in terms of his care, reiterating those comments last night on Fox News.
Yesterday morning, we were real concerned with that. He had a fever, and his blood oxygen level had dropped rapidly.
Today, reporters asked, whose statement should we believe? The president's physician or the White House Chief of Staff seen rubbing his head during the briefing?
I think his statement was misconstrued. What he meant was that 24 hours ago, when he and I were checking on the president, that there was that momentary episode of the high fever and that temporary drop in the saturation.
Hours later, the president, irritated with Meadows, sought to reassure the American people himself.
I came here, wasn't feeling so well. I feel much better now. You don't know, over the next period of a few days, I guess that's the real test. So we'll be seeing what happens over those next couple of days.
The doctors say the president is continuing with remdesivir, an antiviral treatment, and has begun a steroid after his blood oxygen levels dipped a second time.
Yesterday, there was another episode where he dropped down about 93%. He doesn't ever feel short of breath. We watched it, and it returned back up.
Tonight, it's still unclear just how many people connected to the president have been exposed to the virus. His close aide, Hope Hicks, tested positive on Thursday. Despite having close contact with Hicks all week, that day, the president traveled to Bedminster for a campaign fundraiser, meeting with about 100 supporters like Charlie Colleen, who told ABC News he got tested after the campaign reached out to him Friday.
I was surprised to hear that the president did have coronavirus, given how healthy and upbeat he did sound at that event.
Colleen tested negative, but after the news of the president's own positive test broke just before 1 a.m. Friday, The list of others infected seemed to grow by the hour.
3 more people tested positive for the virus.
White House advisor Hope Hicks has tested positive for COVID-19.
Kellyanne Conway tweeting, tonight I tested positive for COVID-19.
3 Senate Republicans have now tested positive for coronavirus.
Today, word the president's personal assistant and body man, Nick Luna, seen next to Hicks boarding Air Force One without a mask Wednesday, is also positive. We still don't know how long the president has been contagious or when he contracted the virus. And health experts fear last week's celebration of Supreme Court nominee Judge Amy Coney Barrett may have been a super spreader event. At a reception inside the White House that day, guests maskless and close together. The same was true outside when the president introduced Barrett. Several in the audience would later test positive, including Senator Tom Tillis, Senator Mike Lee, Kellyanne Conway, the First Lady, the president of the University of Notre Dame, and former New Jersey Governor Chris Christie, spotted here hugging other attendees. Christie was also at the White House on Monday, part of the team prepping the president for Tuesday's debate in Cleveland.
No one was wearing masks in the room when we were prepping the president during that period of time.
Now 5 of the 9 there are positive. Christie, an ABC News contributor, revealing overnight, due to a history of asthma, he checked himself into a hospital as a precautionary measure and is experiencing mild symptoms.
Of course, we're just 30 days from the presidential election. Here with a closer look at the political fallout and where the campaigns go from here is ABC's Andrew Dimber.
Tonight, the Biden campaign wishing the president a speedy recovery and hoping the second showdown between the candidates goes on as scheduled.
We hope that he is well and able to debate. If he is, Joe Biden will certainly be there.
With just 30 days to go until Election Day, the president's diagnosis has thrust the campaign into turmoil. Joe Biden and his wife Jill were both tested today after reporting negative tests Friday. Biden's last contact with the president, Tuesday's debate stage in Cleveland. And now it's time for their running mates to face off. Ahead of Wednesday's vice presidential debate, Senator Kamala Harris says she's prepared for a barrage of lies.
I guess the biggest thing, just to be candid with you, is to be prepared for what is, I think, very likely to be a series of untruths.
And Vice President Mike Pence has said he's ready to take on the former prosecutor.
I think she is a skilled debater, but I can't wait to get to Salt Lake City and be on the stage with her.
Sources tell ABC News they will be seated and spaced 12 feet apart after the Biden campaign requested more space. After the debate, Pence, who tested negative today, will hold an in-person Make America Great Again event in Arizona, expecting a large crowd with limited or no social distancing. But questions mount about his potential exposure to the president and when the president may have been contagious. We know he was in the Oval Office with the president on Tuesday. The White House, though, insists Pence wasn't near the president after he tested positive. President Trump tweeted a message of thanks to his supporters who gathered outside of Walter Reed Medical Center this weekend.
And they've been out there for a long time, and they've got Trump flags, and they love our country.
And his campaign is doing what they can to move forward with the candidate out of commission.
He's getting back on his feet and cracking jokes and asking questions about the campaign.
Planning virtual and in-person campaign events, calling this latest push Operation MAGA. And already some Trump staffers and surrogates in Iowa were seen not wearing masks on the first leg of their Team Trump bus tour. Biden took his message to voters virtually this weekend, and he's pulling all negative ads.
I don't want to be attacking the president and the first lady.
But staying strong on his message, masks save lives.
This is not about freedom. It's about patriotism.
Now I want to bring in infectious disease specialist Dr. Todd Ellerin. And Doctor, what's your biggest takeaway based on what you heard today from the president's physician?
So, Ariel, hearing that the president did require oxygen for at least a temporary period of time, I think takes him out of the mild category of COVID illness and puts him at least into the moderate category. And I think that's probably why the team initiated dexamethasone, that steroid that tries to quiet the immune system. That's not an easy decision to make, because what a large study from the UK showed that if you give patients who don't require oxygen this dexamethasone, their mortality actually increases. Although patients who are on oxygen actually have a decreased mortality from the dexamethasone. So the fact that he was on it temporarily and now is off of it, it's a little difficult to figure out where the risk-benefit ratio of continuing that steroid is. But remember, overall, patients and even hospitalized patients with COVID-19 typically walk out of the hospital. So I'm feeling encouraged about the fact that he's off oxygen and we haven't heard of any other issues.
His doctor saying that could happen as early as tomorrow. And Dr. Ellerin, we heard the good news that Vice President Pence and his wife, the second lady, have tested negative for COVID-19 today for the third day since President Trump's diagnosis. But knowing that he was at that Rose Garden event, how often should he be tested in order to ensure that he hasn't been infected and just could be incubating this virus?
Right. So one of the things we have to be concerned about is the Rose Garden event a super spreading event? Remember, a study from India recently showed it's the largest contact tracing study since the beginning of the pandemic, and it showed that 70% of patients with COVID-19 don't transmit the virus to anyone, whereas 8% of patients can transmit the virus to 60%. So the question here is, was there a super spreader or super spreaders among that audience? And remember, super spreading events is not just about the host, it's also about the behavior. So watching people with inches away from each other not wearing masks really fuels transmission. So it's important to note that masking and keeping physical distance, whether you're inside or outside, remains paramount to decreasing viral transmission.
It's something you have been saying from the very beginning.
Yes, and I think that the testing has to be frequent. Remember, a negative test doesn't mean you don't have to quarantine for 14 days. If you are a close contact, if you are within 6 feet for more than 15 minutes of a confirmed positive case, it's important that you quarantine and have frequent testing.
Should the vice president be quarantining?
I think that's a matter of controversy. Most people who are exposed and are in that category should be quarantined. There are exceptions with essential workers, such as hospital workers like myself, whereas if we're exposed but we test negative, we will continue to work in full PPE, of course, that personal protective equipment. We will treat patients. Of course, if we develop symptoms or test positive, then we're out and we are isolated. I think in this case, in my opinion, it would be best for the vice president to quarantine for 14 days, but I know that's a controversial subject.
Dr. Ellerin, thank you as always for your insight. We appreciate it. And amid all this drama in D.C., New York City, once the epicenter of the virus, is taking new measures to protect against a jump in cases. Trevor Alt has the latest.
Tonight, a major reversal. New York City now threatening to shut down schools and businesses in 9 hotspot neighborhoods, home to more than 500,000 people.
The goal here is to do everything we can to stop something bigger from happening right now.
32 states and Puerto Rico reporting rising cases tonight. The president's positive test Friday, just one of more than 54,000 new infections reported that day, the most since mid-August. On Saturday, Wisconsin logging nearly 2,900 new cases, a record high paired with record hospitalizations and deaths this week.
Our hospitals are getting to a point where they're getting overwhelmed. So if we don't do something now, we're going to be in serious trouble.
This week, North Dakota with record high hospitalizations and deaths. Brian Bushnell's fighting the virus on a ventilator. His wife Rita is infected too.
When it affects you this close, it really is a big deal.
Kentucky hitting a daily record in cases on Saturday. The state's governor now pleading with people to be responsible.
Everybody needs to be wearing a mask. No more being casual. Time to be urgent.
But in many areas, health experts' dire warnings are getting ignored. Deputies shutting down this massive charity car show east of Los Angeles for violating local guidelines. And fraternities still causing concern. 144 people testing positive at the University of Washington's Greek Row.
It's a big problem, obviously.
But the pandemic's still taking a heavy economic toll as well. The owner of Regal Cinemas considering temporarily closing its more than 500 theaters nationwide after reporting a loss of more than $1.5 billion.
Our thanks to Trevor Alt. That does it for us here on ABC News Live. We will continue to bring you the very latest on President Trump's condition as we have it. I'm Ariel Reshef in New York. Stay safe. Have a great night.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.